Clinical rotation in dermatology and venereology for 9th semester students of the Faculty of Medicine. The dermatology and venereology clinical rotation in the 9th semester is designed to train medical students in recognizing, diagnosing, and managing various skin disorders and sexually transmitted infections, STIs. This rotation focuses on clinical skills in history taking, physical examination, differential diagnosis, and appropriate therapy, including handling acute and chronic dermatological conditions and STI cases. 1. Objectives of the dermatology and venereology rotation. Clinical competencies: understand the physiology of the skin, pathophysiology of skin diseases, and mechanisms of sexually transmitted infections. Diagnose various skin conditions based on clinical manifestations and supporting examinations. Determine and provide appropriate therapy for skin diseases and STIs. Procedural competencies: perform systematic dermatological examinations. Use simple diagnostic tools such as dermoscopy. Conduct minor procedures, including skin biopsy, minor excisions, or cryotherapy applications. Communication and collaboration: communicate effectively with patients to explain chronic skin conditions or those that impact quality of life. Educate patients on STI prevention and the importance of treatment adherence. 2. Learning structure and daily activities. This rotation includes learning in outpatient clinics, inpatient wards, and specialized units such as STI clinics or aesthetic medicine clinics. A. Dermatology and STI outpatient clinics activities. Evaluate patients with skin complaints such as rashes, pruritus, or skin lesions. Examine and manage STIs like syphilis, gonorrhea, or genital herpes. Consult patients with chronic dermatological issues like psoriasis or atopic dermatitis. Objective: train students in dermatological history taking, physical examinations, and forming differential diagnoses. B. Inpatient wards activities. Manage severe dermatological cases such as erythroderma, pemphigus vulgaris, or Stevens-Johnson syndrome. Monitor patients requiring systemic therapy such as corticosteroids or immunomodulators. Objective: understand intensive management of dermatological cases requiring hospitalization. C. Aesthetic medicine clinics activities. Observe aesthetic procedures such as chemical peels, laser therapy, or microdermabrasion. Consult patients with aesthetic concerns like hyperpigmentation or acne. Objective: introduce students to cosmetic dermatology and aesthetic procedures. D. STI clinics activities. Examine STI patients, including history taking on risky sexual behavior. Perform diagnostic tests such as VDRL, gonorrhea cultures, or HPV-PCR. Provide counseling on STI prevention and partner management. Objective: train students in holistic approaches to STI patients. 3. Diseases and conditions covered. A. Skin diseases: dermatitis, atopic, contact, and seborrheic dermatitis, managed with emollients, antihistamines, or topical corticosteroids. Psoriasis. Diagnosis based on clinical features such as thick scaly erythematous plaques. Therapy with topical agents, phototherapy, or systemic therapy like methotrexate. Skin infections, bacterial infections, impetigo, folliculitis, treated with topical or systemic antibiotics. Fungal infections, tinea, candidiasis, treated with topical or oral antifungals. Viral infections, molluscum contagiosum, herpes zoster, managed with antivirals and supportive therapy. B. Sexually transmitted infections: syphilis, diagnosed with serological tests, VDRL, TPHA. Treated with antibiotics such as penicillin. Gonorrhea, diagnosed through genital fluid culture. Treated with antibiotics such as ceftriaxone. Genital herpes, diagnosed based on clinical presentation and PCR. Treated with antivirals, acyclovir. Genital warts, diagnosed through visual inspection or HPV-PCR. Treated with cryotherapy or topical agents like podophyllin. C. Autoimmune dermatological diseases: pemphigus. Diagnosed via skin biopsy and immunofluorescence. Treated with systemic corticosteroids and immunomodulators. Lupus erythematosus, diagnosed based on clinical features and ANA testing. Treated with topical or oral corticosteroids. D. Pediatric dermatological diseases: viral exanthems, diaper dermatitis, and hemangiomas. 4. Mastery of clinical procedures: basic procedures. Perform dermatological physical examinations, including lesion inspection. Use tools like dermoscopy for evaluating pigmented lesions. Collect lesion smears for microscopic examination. Advanced procedures, under supervision. Perform skin biopsies for histopathological diagnosis. Conduct cryotherapy for warts or superficial lesions. Perform minor excisions for small lesions like nevi. 5. Learning methods: A. Bedside teaching. Observe and participate in dermatological examinations and procedures. B. Case discussions. Analyze cases like psoriasis or syphilis to understand pathophysiology and therapy. C. Clinical simulations. Practice procedures like skin biopsies or cryotherapy. D. Observation and participation. Observe dermatological interventions in aesthetic clinics. 6. Assessment: A. Daily evaluations. assess history taking, dermatological examination, and differential diagnosis skills. B. Mini CEX. Evaluate procedural skills such as skin biopsies or interpretation of diagnostic tests. C. OSCE. Simulation-based exams for dermatological scenarios. D. Logbook. Document clinical experiences during the rotation. 7. Challenges and opportunities. Challenges. Complex diagnoses of skin diseases with similar clinical presentations. Social stigma faced by STI patients, affecting openness during history taking. Opportunities. Direct experience in managing common dermatological and STI cases in clinical practice. Introduction to cosmetic dermatology, a growing field in medicine. Conclusion. The Dermatology and Venereology clinical rotation provides a strong foundation for understanding and managing skin diseases and sexually transmitted infections. With a holistic clinical approach, students are prepared to identify dermatological issues, provide appropriate therapy, and educate patients on disease prevention and care. This experience enhances students' competency in managing patients comprehensively.